Greetings to the Commander-in-Chief of the EFF, Julius Sello Malema, the leadership and ground forces of the emancipation movement. The Department of Health is characterized by consistent failure, a curative approach to healthcare instead of preventative, executive and management failure, and catastrophic corruption levels. These are the adjustments that we propose as the EFF to save this department from further decay under the stewardship of Minister Motsoaledi. In the midst of collapsing clinics, medicine shortages, staff shortages, HIV and TB pressures, and corruption facilitated by national management and officials of this department, program number 4 for primary healthcare only increases from 3.7 billion to 3.8 billion rands. This is politically indefensible, Minister. How do you plan to deliver a community-centered and prevention-led public healthcare system under this condition? You must increase this allocation by at least 5 billion rands. This is the only way you can prioritize 24-hour clinics in townships and rural areas, mobile clinics, maternal health care, and mental health services. We propose an increase for infrastructure with caution, as we have seen what ANC comrades and allies do with money is meant to build our hospitals and to keep our people alive. Mapulaneng Hospital in Mpumalanga, we were promised a state-of-the-art hospital over 6 years ago. 3 billion rand has been spent to date, and yet there's still no hospital in Namhlanje. And furthermore, at the previous hospital, doctors have to leave operation rooms during surgeries to go and collect water outside because the water tankers are not connected to the hospital. We've raised this with the minister's office, we've raised this with the provincial government, and Namhlanje, nothing has been done. Add 8 billion rands to infrastructure emergency fund to deal with revitalization of rural hospitals, township trauma centers, oxygen and energy backup systems, water infrastructure, oncology equipment, and public pharmaceutical manufacturing infrastructure. The department spends excessively on outsourced services. You must place focus on building internal capacity, and you must cut contractor spending. You must adjust the consultant expenditure by reducing the 250 million allocation by 50%. The 609 million rents for contractors must be reduced by 80%, and the 110 million on travel subsistence must be cut out completely, as there's no reason at all to outsource non-essential services. These are responsibilities the department can already do for itself. You must redirect the approximately 800 million from these cuts towards hiring nurses and doctors, ambulance personnel, biomedical engineers, cleaners, pharmacists, and hospital maintenance teams. The OHSC is heavily underfunded and as such can only inspect 20% of public facilities and only 16% in the private sector. This means that corruption, negligence, and patient abuse thrive. You must increase the OHSC allocation by 500 million so they can employ inspectors on a permanent basis and establish a system that can be monitored nationally for their inspections. This will greatly assist the department itself in the investigations of medical legal corruption. We must add 3 billion rands to emergency medical services nationally. We have a crisis of ambulances, Minister. In provinces like Eastern Cape, Limpopo, Northwest, Mpumalanga, KZN, rural districts, this crisis is actually severe. Furthermore, this crisis exacerbates apartheid special planning that alienates poor communities from vital health services. With this 3 billion, you must expand ambulance fleet, invest in helicopter emergency services in remote provinces, train paramedics, and build a digital dispatch system that actually works. It sounds undoable because for so many years, this department has allowed price inflation and tender procurement systems to thrive. It is actually very much doable. You acknowledge underspending yourselves on human resource. Why not address this? Increase the post to be filled immediately by the following margins. Add 10,000 nurses, 3,000 doctors, 2,500 community healthcare workers, mental health practitioners, and laboratory specialists. Where must the money come from? You might ask. It must come from the money found in wasteful expenditure, wealth taxing financing mechanisms, and anti-corruption recovery. Minister Motsoaledi, we have run out of the patience to tolerate the blatant disregard of this department by the officials entrusted with responsibility. And we blame you because you're the political head. You can no longer claim ignorance when the department you're leading is being looted at this large scale. Not doing anything about it not only makes you complicit, it actually makes you responsible for it. There are hundreds of other issues that suffice that we have raised consistently with you over the years. An example is failure to provide justice for victims of forced sterilization of Black women. You have the recommendations from the CGE, but you're doing nothing about it. Another example is the HIV billion 15 rand tender. 15 billion rand tender. We've highlighted red flags consistently with the minister for over a month, and he has done nothing about it. It will again take the EFF to take the steps to fix the problem in the department that you are leading. Minister, if the heart for this work of keeping our nation alive and keeping humanity alive has left you, please kindly follow your heart. We reject this budget, this austerity budget. In fact, we call on South Africans who wanted 24-hour clinics open 7 days a week to register to vote for the EFF. The GNU leaders access healthcare as and when they please, but they deny this basic human right to the poor and vulnerable South Africans. Vote EFF on the 4th of November for 24/7 clinics in South Africa. Mandla.